There are a lot of promises online that claim they can cure autism. They often use words like recovery, reversal, detox, or healing the root cause. They circulate in parenting groups, Telegram channels, private forums, and short viral videos. They usually come with dramatic before and after stories and emotional testimonials. And they are almost always targeting exhausted, scared, loving parents who just want their child to suffer less. This video is not about blaming parents, it is about protecting them. Because many of these so-called treatments are not just ineffective. Some of them are dangerous. Some have injured children, some have killed people, and many delay real support that actually helps. Let's talk about the most common autism cure hoaxes, what they claim to do, what they actually involve, and why they are harmful. First, miracle mineral solution, often called MMS, chlorine dioxide, or CD. This is one of the most extreme and dangerous claims online. MMS is essentially an industrial chemical used for bleaching and disinfection. It is marketed under different names and framed as a detox, parasite cleanse, or immune reset. In autism spaces, it is often described as removing toxins or killing hidden pathogens that supposedly cause autism. Parents are told that vomiting, diarrhea, rashes, or pain are signs that it is working. This is often described as die-off. In reality, those symptoms are signs of chemical injury. There is no credible scientific evidence that chlorine dioxide treats autism. There is extensive evidence that it can cause serious harm, including burns to the digestive tract, dehydration, liver damage, and dangerous electrolyte imbalances. Health agencies around the world have issued warnings about it. Calling this a treatment is not accurate. It is chemical poisoning dressed up as healing language. Second, chelation therapy for autism. Chelation is a real medical treatment. It is used in hospitals for confirmed heavy metal poisoning. It involves medications that bind to metals so they can be excreted from the body. The problem is how chelation is used in autism spaces. Many parents are told that autism is caused by hidden heavy metals, even when there is no exposure history. Some clinics use provoked urine tests, which artificially inflate metal levels by giving a chelating agent before testing. This creates the illusion of toxicity. Chelation is then offered as a cure. Chelation is not approved as an autism treatment. It can remove essential minerals like calcium and potassium, not just metals. This can cause heart rhythm problems, kidney damage, seizures, and in at least one documented case, death. Chelation without a confirmed diagnosis of heavy metal poisoning is not just unproven, it is dangerous. Third, hyperbaric oxygen therapy promoted for autism. Hyperbaric oxygen therapy involves breathing oxygen in a pressurized chamber. It is legitimate for a small number of medical conditions, like certain wounds or decompression sickness. In autism spaces, it is often marketed as healing the brain, reducing inflammation, or restoring oxygen to damaged areas. There is no reliable evidence that it improves core autism traits. HBOT is expensive, time-consuming, and not without risk. Side effects can include ear injuries, sinus damage, oxygen toxicity, and anxiety or distress, especially for children with sensory sensitivities. The danger here is not just physical, it is financial and emotional. Families can spend tens of thousands of dollars chasing improvement that never comes. Fourth, secretin injections. This is an older example, but it still resurfaces. Secretin is a hormone involved in digestion. In the late 1990s, it was briefly hyped as an autism breakthrough after anecdotal reports suggested improvements. Large controlled studies were done, they showed no benefit. Despite this, some clinics and online communities still promote secretin as a hidden solution or claim that it only works for certain children. This is a pattern you will see repeatedly. When evidence fails, the claim shifts instead of stopping. Fifth, antifungal and yeast overgrowth protocols. This theory claims that autism is caused by chronic yeast or fungal infections, often candida. Children are put on strict diets, supplements, and sometimes long courses of prescription antifungal medications. When symptoms worsen, this is again framed as die-off. There is no evidence that yeast causes autism. Long-term antifungal use without a confirmed infection can harm the liver, disrupt normal gut flora, and increase drug resistance. Many children subjected to these protocols experience nutritional deficiencies due to extreme dietary restriction. Sixth, detox protocols as a category. This includes a wide range of products and practices: binders, Drops, clay, foot baths, coffee enemas, parasite cleanses, heavy metal flushes. The underlying claim is that autism is caused by toxins and that the body must be cleaned out. The problem is that autism is a neurodevelopmental condition, not toxin buildup. Many detox practices can cause dehydration, electrolyte imbalance, gut injury, or malnutrition. Some lead parents to stop evidence-based therapies or medical care because they are told those interfere with detox. This is where harm often becomes cumulative rather than immediate. Seventh, the vaccine reversal narrative. This deserves careful language. Regardless of personal beliefs, the reality is that the vaccine blame narrative fuels many of the dangerous treatments already discussed. It creates the idea that autism is an injury that must be undone, rather than a neurodevelopmental difference that needs support. This framing pushes families toward chelation, detox, bleach products, and extreme protocols. Even when parents do not fully believe the narrative, the fear alone is enough to make them vulnerable to exploitation. So how do these hoaxes spread so effectively? They follow a predictable pattern. They promise recovery or reversal. They claim a single hidden cause. They rely heavily on testimonials instead of controlled studies. They reframe side effects as proof of effectiveness. They discourage mainstream clinicians or frame them as ignorant or corrupt. They sell protocols, not just products, and they almost always require long-term commitment, escalating cost and isolation from outside perspectives. There is also a deeper emotional layer. Autism cure culture preys on grief. It tells parents that acceptance means giving up, that love requires fixing, and that if a child does not improve, someone failed to try hard enough. That is not medicine. That is manipulation. Here is what is important to say clearly. There is no cure for autism. There are supports, therapies, accommodations, and medical treatments that help specific symptoms. There are ways to reduce suffering, improve communication, and support regulation, but anyone promising to remove autism itself is not being honest. Calling these claims hoaxes is not an insult. It is a safety warning, because when false hope is sold as treatment, the cost is paid by children. If you are a parent who has encountered these claims, this video is not judging you. It is saying you deserve better information. You deserve honesty. You deserve support that does not put your child at risk. And you deserve to know that autism does not need to be cured to be worthy of care, dignity, and a full life. If this helped you understand what is out there and why it is dangerous, please consider sharing it. These conversations protect people. And if you want a follow-up video breaking down what evidence-based autism support actually looks like or how to evaluate medical claims online, you can let me know. You are not failing for wanting answers, but the answers need to be real.